This video will overview proper documentation of both the MedPass as well as controlled medications. So when it comes to documentation, you want to ensure that you are documenting your MedPass before you move on to the next resident. Do not attempt to pass all your residents' medication and then go back and try to remember everything and document it all. If you have missed doses and you have a paper MAR, you're going to initial and circle that MAR for the missed dose. You're going to note the reason on the back of that paper MAR. If you have an EMAR system, then you're going to properly notate that on that dose that it was missed, as well as the reason. If there's a discontinued medication and you're using a paper MAR, you're going to highlight the entry and then write DC'd on that particular location of the paper MAR. If an item is DC'd, ensure that you have a written order from the physician sent to us at the pharmacy so that we can properly discontinue that and ensure that you do not receive that when the patient shouldn't even be taking it. For PRN medications, you're going to properly document that on the MAR, whether paper or electronic. You're going to sign it for paper, date, time, and then why it was used, and then also document the effectiveness of that medication on the reason for that resident taking it. And that'll be done on both paper MARs and EMAR. Documentation for controlled substances is a little bit more involved. You're still ensuring that you're documenting in the paper MAR or the EMAR system, but there is a controlled substance accountability form, also called the control sheet, that is tied to each prescription. And then that documents the doses given as well as how many doses are left of that controlled substance. And then there is a controlled substance count verification form, and that is for reconciling the counts in between each shift. And then this is done at each shift change. If there are any discrepancies, that must be reported to your DON or your supervisor immediately so it can be investigated and corrected. Here is a example of what a paper MAR or medication administration record looks like. It will show the name of the medication, the directions, the times when those are supposed to be administered, and then as long as it is available in our system, it will also have an image of the medication. This is what the PRN medication MAR looks like. The back of the MAR. So this is where you would indicate why you were giving a PRN medication, and then the result or the effectiveness of it. On that MAR, you'll see different site codes. So here's just a general overview of them. This is what our controlled substance accountability form looks like, and this is what will be included with each medication that is a controlled substance. This is the count verification form for what is utilized between each shift. And then some common scheduled medications. So you have your Schedule 2, 3, 4, and 5. The Schedule 5 being Lamodal, the diphenyloxate, Schedule 3, Marinol, Schedule 4, the Xanax, Klonopin, Valium, Tramadol. Schedule 2 is your Demerol, methadone, morphine, oxycodone, Vicodin.